own techniques up. So I take 10 different techniques, I take the few things out of each technique and put it into what I feel is the best. That's what I've done pretty much with health too.
Yeah.
There's a lot of good stuff, it's just not affordable for people to get healthy. Okay, so I try to, as you know, try to make it so most people can afford things.
Yeah.
And then figuring out how to practice takes at least 10,000 people before you can even start to figure out any of your own technique, because you got to try to figure out the other ones first. So you find out that this isn't good. Oh yeah, this is incorporated, and this is like I just gave you guys generalized aggressive adjustments. But I've never even adjusted before, but I said, did you generalize and I did you aggressive. Usually, in the old me, because I didn't know who you are, I have to really figure out a few things first just to make sure if you've got a super sensitive nervous system or your nervous system's not sensitive at all. But after a while, you can sense. You guys have vitality, so I can adjust you aggressively. It took me a while. I didn't want to hurt Dr. Marcus. Her ligaments are way too stretchy. So I had to be wimpy with her first couple of times because she doesn't adjust well. She's hard to adjust. I mean, her ligaments are way too stretchy. She's got certain areas that are super strong and other areas that are really flexible. And that's...
Tug of war.
I'd rather have someone stiff all over because I can stretch them out all over versus one area that's super stretchy and one that's so stiff because it's compensating over for the super stretchy spot.
Yeah.
So these ligaments are hypermobile, which means you need boron to stiffen them up. And these ones are super stiff, which means you need a lot of fulvic acid to break all that garbage apart. The oxalates, the stiffness, the arthritis, they're oxalates. Oxalates calcium and like an acid that makes the stiff corroded. And so what you do is you put the fulvic in there and it starts eating the corrosion like WD-40 on a rusty hinge.
Nice.
But you got to work it. You don't just spray it in there. You got to go back and forth with the nut, right, to go able to get it off the, it's the same with the body. You got to work it out. This is where it takes your low back in a couple of years if you work with it like mine. I fixed mine. Mine bothers me very minimally. Otherwise, I was like this for 3 years.
Yeah.
Crooked just like this. And I have foot drop. Okay, I mean, that's miserable.
Oh yeah.
Super miserable. And no one knows back pain until you have it. Once you get it, you go, okay, you weren't a little sniveling little baby after all. Wuss. No, when you have back pain, especially if you're a man, you get it in your testes, it hurts your leg, you're walking around going, you feel like you got kicked between the legs. You get pain in your leg and your leg's going, my leg used to be numb from here to here. I could pinch it with a needle. I couldn't feel a thing. Myself. Put it in like a ½ inch. This one, I just tipped it in, woo, that one's sensitive. This one here's dead as a doornail. This one's about probably 95%. It's like 5% dead still. But it used to be like 90% dead. Oh, I could hit this thing as hard as I want. I couldn't feel a thing. Now that it's sort of, this one's just a little duller. Yeah.
What happened to that one?
This is where I had my disc prolapses and it made me have foot drop on the side. So when I walked, I couldn't pull this foot back.
Right.
Because it made you so you have foot drop. You're walking and your foot won't,
Like that,
it won't do this. Okay, and it's an automatic, thing, because your mind doesn't think about lifting your foot. It's an intrinsic system. But you'll know when it's not working, it's because you trip over your feet and then you hurt your ankle. That's how I hurt my ankle. Got foot drop, all of a sudden my foot gets stuck on the stair and then bam!
Yeah.
And all of a sudden then you get sort of paranoid walking because you got to really watch where you're going with foot drop. Because you don't have the, it's like sort of like a Novocaine in your mouth. You bite your tongue. You can't feel it. No. You been adjusted before? Never? Well, let me just do your neck lightly then, and we'll work on you a little bit at a time. You've never been adjusted before?